Imagine your morning starts as usual. You wake up, make your coffee, check your phone. Suddenly, something feels off. Your head feels heavy, like fog. Your vision darkens, and the words you want to speak seem stuck in your mouth. This happened to Alex. He considers himself healthy, works out regularly, and never worried about serious health problems. But today, he felt strange numbness in his right hand, slight weakness in his leg, and an inexplicable panic. For a moment, it passed, and Alex thought it was just fatigue. But these were the first warning signs of a stroke. Many people ignore such signals, blaming them on tiredness, stress, or diet. Meanwhile, the body is shouting, something is wrong. A stroke doesn't always happen suddenly. The body often gives warnings hours or even days before a critical event. Vision problems, double vision, temporary limb weakness, strange panic, headache, all of these are early alarms of the brain. They accumulate over time, and ignoring them can have deadly consequences. Have you ever noticed that even the tiniest changes in your body can signal a serious problem? That's what Linda, a young woman who always considered herself active and healthy, experienced. One morning, she woke up with slight weakness in her left hand and tingling in her fingers, but she decided it was just from long hours at the computer. However, within an hour, she noticed that words wouldn't cooperate. During a conversation, she tried to say a simple sentence, and it came out jumbled. Linda felt slight dizziness and sudden instability while walking, and a subtle panic began creeping in for no apparent reason. She started getting confused with minor tasks at work, forgetting simple things she usually did automatically. Colleagues noticed she wasn't reacting as quickly, and friends sensed her quietness and irritability. These signals are not accidental. Each one shows that the brain isn't getting enough oxygen and blood flow. A mini stroke or transient ischemic attack is the brain's way of warning of a serious problem. Many people ignore these signals, blaming them on fatigue, stress, or diet. But if they are overlooked, the next attack could be much more severe. Linda decided to act. She immediately went to a doctor, underwent examinations, and received timely treatment. This saved her life. It's important to remember, even short symptoms lasting a minute or two should not be ignored. Every signal from the body is a chance to prevent a catastrophe, a chance to save your life. Let's meet David. He is 38, active, considers himself healthy, exercises, and watches his diet. But one morning he felt strange weakness in his right leg and sudden brain fog. At work, he tried to focus, but ordinary tasks that he usually performed automatically became difficult. During a meeting, he noticed words wouldn't come out. Sentences got jumbled. Colleagues noticed his stillness and unusual pauses in speech. David thought it was stress or fatigue, but a few minutes later, numbness returned. He remembered Linda's story and immediately called an ambulance. Examinations revealed a transient ischemic attack, a warning from the brain. If you don't listen, a stroke will come. After this event, David started learning how the brain works and how it signals danger. He discovered that before a stroke, warning signs often appear that people attribute to fatigue: slight numbness in limbs, instability while walking, temporary double vision, unusually strong headache, sudden unexplained anxiety, speech problems. These are not random symptoms. They are signals from blood flow in the brain, giving a chance to intervene. But not everyone has someone to notice these signals. Next, we will look at stroke mechanisms without specific people, explaining causes and consequences. Blood flow in the brain is a complex process. When an artery is partially blocked, the brain receives less oxygen. Brain cells are extremely sensitive. If blood supply decreases even for 5 to 10 minutes, neuron function begins to fail. This manifests as brain fog, numbness, speech problems, dizziness, or sudden fear. Some people experience slight limb weakness or unsteadiness while walking. Another mechanism is a thrombus or vessel spasm. When blood doesn't flow properly, neurons don't get energy. Signaling between brain areas is disrupted. That's why someone may temporarily lose coordination or experience blurred vision. Sometimes symptoms last only a few minutes and then disappear, but the brain has already warned. the risk of stroke is high. Additionally, chronic stress, high blood pressure, obesity, smoking, and a sedentary lifestyle increase the risk of blocked vessels. Even mild symptoms lasting a few minutes must not be ignored. The body gives a chance to intervene, and every minute counts. A stroke is a sudden disruption of blood flow to the brain that can occur at any moment. There are two main types of strokes: ischemic and hemorrhagic. An ischemic stroke occurs due to an artery blocked by a clot or plaque, which prevents blood from reaching part of the brain. A hemorrhagic stroke happens when a blood vessel bursts and blood leaks into the brain, damaging tissue and disrupting neuron function. Both types can cause sudden weakness, speech problems, numbness in limbs, dizziness, loss of coordination, blurred or double vision. The brain is extremely sensitive to oxygen and glucose. When blood flow is disrupted, neurons begin to die within minutes. Speed of reaction is critical. Even a small artery blockage can lead to a transient ischemic attack, a mini stroke, which warns of serious danger. Symptoms may be temporary or subtle: slight numbness in fingers, tingling in limbs, mild unsteadiness while walking, vision changes, sudden headache, or inexplicable anxiety. People often dismiss these signs as fatigue, stress, or poor sleep, but the brain uses these signals as a last chance to prevent a critical event. In addition to acute symptoms, there are chronic risk factors that increase stroke likelihood: high blood pressure, chronic stress, smoking, sedentary lifestyle, obesity, diabetes, poor diet. Each of these factors gradually weakens blood vessels and makes the brain vulnerable. After a stroke, devastating changes occur in the brain and body. Neurons that do not receive enough blood die. This can lead to paralysis of one side of the body, speech difficulties, memory problems, coordination issues, emotional control problems. The longer someone ignores warning signs, the more severe the consequences. Rehabilitation can take months or even years, and some functions may never fully recover. Therefore, rapid response is key to survival. If any signs appear, do not wait for them to go away. Call an ambulance and report symptoms as accurately as possible. Every minute matters. Proper diagnosis and treatment within the first hours can save a life and preserve brain health. Now let's summarize everything we've learned. A stroke is not a sudden blow that happens out of nowhere. It is a process that can begin days or hours before a critical event. Our body constantly gives signals: limb weakness, tingling, unsteadiness while walking, double or blurred vision, dizziness, sudden headache, confusion in speech, heightened anxiety. These signals must not be ignored. We saw how Alex, Linda, and David felt these warnings and how timely action saved their lives. Even if symptoms disappear within a few minutes, it is a transient ischemic attack, the brain's last chance to warn of danger. Chronic risk factors: high blood pressure, stress, sedentary lifestyle, obesity, smoking, diabetes only increase the likelihood of stroke. It's important to remember every minute counts. Proper response in the first hours can save life, preserve speech, mobility, memory, and emotional health. Do not ignore your body's signals. Listen to it, consult a doctor at the first signs, and practice prevention. Monitor blood pressure, stay active, eat healthy, manage stress. Remember, a stroke is not a verdict. It is a challenge you can respond to in time if you recognize the signs and act. Your life and health are in your hands. If this video was helpful and you want to learn more about health, the brain, the body, and prevention, subscribe to the channel, like the video, and share it with your loved ones. Every view can save a life because knowledge is power and quick action is a chance to live.